Good afternoon, everyone. This is Dr. Ingrid Garrison. I'm the State Public Health Veterinarian with the Kansas Department of Health and Environment. And I was happy that Tyler with the Kansas Department of Agriculture's Animal Facility Inspection Program um, helped me to get this presentation out to you. And the last time I did this was in 2016, and it got a lot of positive feedback. And so I thought it'd be time to update it again since it's been a little bit. And based on your feedback, which I would appreciate if you either like this presentation or don't, to let Tyler know. And I'd like to do this every year, just like we do at the local health departments. Our local health departments investigate all manner of reportable infectious diseases in humans, but also they investigate all the animal rabies cases in the state, and we're going to talk about that a little bit. But we do give a similar presentation to the local health departments every year, and it's probably one of our most well-attended webinars just because there's a lot of information to cover, and there's always new people coming on board. So again, if this is something you find useful, please let Tyler know. Or if you didn't find it useful, let her know that too, so she doesn't have you guys listen in again. So we're just going to go ahead and get started. If you have any questions, please type in the chat box. I'll also be able to stay on after a little bit at the end of the presentation to answer questions, or you can email me directly. And with that, we're going to go ahead and get started. And Tyler, can you give me a thumbs up or let me know that you can hear me? Or just
I can hear you, Ingrid.
perfect. Okay, great. We did a run through earlier, so just want to make sure it's still working. All right, so we're going to get going. As soon as I can figure out how to advance the slides. Here we go. See, this is why we do run throughs. Okay, so these are some of the things that I find that would be very helpful for animal shelters to know about rabies. And I also have the slide at the end, but if you kind of have other things to do during the presentation or have to leave, these are the things I would say that are the big takeaways. That if you have a suspect rabies case, or really frankly any questions at all about rabies, you can call your local health department, your county health department, which I know some of you already work with, or you can give us a call. All the counties do have after-hour numbers, but some of them are easier to reach than others. We have somebody on call 24 hours a day, 7 days a week, 365 days a year. And that person is trained in rabies to be able to answer your questions. So if you call this 877 number, and it'll be on again at the end of the presentation, please put that in your phone, any protocols you have written up, and we'll be happy to answer those questions for you. You really should be protecting yourself and your staff from potential rabies exposures. I encourage you to review your city, county, or state laws on rabies vaccination, confinement, and quarantine. I know that some shelters do get involved in this. And then also you should have written protocols, and your staff should be trained on vaccine principles if you guys are vaccinating animals with your veterinarian. Animal bites and scratch management as well. So those are just some of the highlights from this presentation today. So why is rabies such a concern? It's considered one of the world's deadliest diseases, and it impacts about 5 billion people. Most of those people are in the continents of Asia and Africa. And even to this day, rabies still kills about 59,000 people worldwide, with most of those being in Africa and Asia. And about 40 to 50% of those are children under the age of 15. If you think about it, those are the population who are interacting with dogs. And almost all of those deaths are attributed to canine variant rabies. So the type of rabies that circulates from dog to dog. And there's a huge impact on cost. But the thing about this disease, unlike many other infectious diseases, is that it is 100% preventable with appropriate post-exposure prophylaxis. And so let's talk about rabies in the US. There's about 26 human cases over the last decade. The most recent numbers are from 2018. Some of those are from people that have gone overseas and been bitten by a dog and didn't know to seek treatment until it was too late, and they passed away. 12 of those cases that were infected in the US had contact with a bat. And 5 of those, that should have been moved, that next bullet should be moved over. 5 of those had unknown exposure, so the person died. They weren't ever really able to figure out where they contracted the virus. They can tell what type of virus it is. The rabies has specific types or viral types, such as canine, skunk, raccoon, bat. So they can actually even tell the type of bat it came from. But oftentimes when they interview the family, they, for those 5 cases, they just don't really have any explanation as to where the person may have been exposed. Fortunately, in Kansas, our last human case was in 1968 in a boy who died in Elk City, Kansas from a dog bite. However, Missouri has had a couple of more recent cases. Both of those were exposure to a bat, and both of those people did die. So there is more burden than just the number of rabies cases, of human rabies cases, because that's really just the tip of the iceberg. If we think about animal bite prevention, about half of all Americans at some point in their life will be bitten by a dog, and about 4.5 million people are bitten by dogs in the U.S. each year. And that is a tremendous impact on public health and health resources and the people to whom are bite victims, including people who go to the emergency department for treatment. There are people who are hospitalized and also people who die. There's a lot of medical costs associated with this. And again, most of these dog bite victims are children. And then there's also significant impact on rabies post-exposure prophylaxis. If the dog was unavailable for observation or testing, then people are recommended post-exposure prophylaxis. We'll talk more about that later. Rabies is a virus. It does have an affinity for the nervous system, and it only infects mammals, so those animals that have fur, bear live young, and produce milk. There are some animals that are more susceptible to rabies than others, but basically any mammal can be infected with the rabies virus. The virus itself is only found in the saliva and neural tissue, so like the brain and spinal cord only. It is not found in blood or skunk spray. So we get those types of questions a lot. The virus is found in the saliva, salivary glands, and the neural tissue only. It's not a very hardy virus. It actually can be killed pretty easy just through drying. And when it dries out, inactivation by UV light, such as sunshine, and common disinfectants kill it. It really needs a living host to survive. And so once the animal dies, it deteriorates pretty rapidly. So that is the good news about that. So knowing the transmission cycle is important, and you could put a dog or a cat in the place of this human for this, but essentially this will help also to explain to you why we have a little bit of time to wait before we start prophylaxis, and why the prophylaxis works as well. And so the takeaway from this slide though is that it does take time for the virus to reach, the time that it takes the virus to reach the brain, where it causes encephalitis and eventually death, depends on many factors, which include the type of virus. So remember I had mentioned to you that there's different variants of the virus. Some are much more aggressive than others. And the closer that the bite is to the brain, because the virus latches onto the nerves. So in this case, in step 1, the dog, or you could put a skunk or a bat in here, bites the person. The virus enters via a bite through the saliva into the body, okay? And then the virus has to replicate in high enough numbers to then grab onto the nerve and start hitchhiking its way up the nerves into the spinal cord. And then eventually it'll go up the spinal cord and get into the brain. So you really have a little bit of time before you absolutely have to give the post-exposure prophylaxis. I mean, we usually don't like to delay more than a few days time to find the dog or the cat or to get the test results back. Now, if it's a bite to the face, we may start prophylaxis immediately because of the short distance to the brain. But again, it's going to take a little bit of time for that virus to replicate. But this is why it's important also that you go ahead and consult with your healthcare provider about prophylaxis, or your local health department or KDHE can help with that as well. So in animals, and very similar to people, it causes a viral encephalitis, so an inflammation of the brain. And so that's where the signs, clinical signs in animals come in. There are some differences potentially, but they all start off as sort of non-specific illness. The prodrome phase is really before what we call the time period before the animal gets really clinically ill. And that's where you may see a change in behavior, such as a normally friendly animal becoming reclusive, or a normally shy animal becoming more approachable. And so the hallmark of this disease, though, is once those changes start, it's very rapid deterioration within days. So you're not going to have an animal that's ill with rabies for weeks. It'll only take days for this animal to go from just being sort of kind of ill to either near death or dead within just a few days. You've probably heard furious versus dumb rabies. So we don't really classify them that way, but mainly just to keep in mind that it can present in a variety of ways. Usually animals go off feed. They're inappetent. They may or not be, or they may be the reverse of that, which I'll talk about in a later case. And they can be very restless. They may be limping, difficulty swallowing, and it can progress again very rapidly to seizures and death. And so that's usually some sort of paralysis, which is why they have difficulty swallowing. But again, very, very rapid progression of this disease within very rapid progression within days. Usually death is within a week or less. So the only way you can confirm a diagnosis of rabies is through a post-mortem sample or a post-mortem test of the brain. There's no way to do it while the animal is alive. So Kansas State University Rabies Laboratory performs all the diagnostic tests of animals. However, you're welcome to send it to any lab, but most people in Kansas send it to K-State. And we get questions all the time, well, who pays for the test? We don't have any discrete funds at KDHE to pay for rabies testing, nor do most local health departments. Now, I will say that that depends, and I would encourage you, if you have not already done so, to call your local health department. And if you need that number, let me know, I can get it for you. It's just whatever your county health department is, and talk to the administrator or somebody, a nurse in the communicable disease section. Some counties have an environmental health section, and I find that those are the folks that deal with rabies cases. So if you already have a protocol in place, great. But if you're not sure, then I would definitely reach out and talk to them and see what their protocols are. But KDHE does not have a rabies fund, unfortunately. Sometimes the bite victim or the animal owner ends up paying for it. Sometimes animal control pays for it. But the bottom line is, if there is an exposure to an animal that is a veterinarian strongly suspects has rabies, that we have to find, public health has to find some way to pay for the test if the bite victim cannot. And that's through its statute that says that the local health department is responsible for preventing the spread of communicable disease in their community. And so again, I would really encourage you, if you haven't done so already, to call your local health department. Be a great time for you to meet them and talk about them, hopefully before you need them. So rabies is considered endemic or found throughout all of Kansas, every county. There's no rabies-free county in Kansas. We consider rabies to be everywhere. Rabies is pretty well established in the United States. This is a map from the rabies surveillance data publication by Centers for Disease Control and Prevention. They do it every year. This is from 2017. And this is just to show you where the terrestrial or land reservoirs of rabies are located. And bat rabies is endemic or found everywhere throughout the United States, but this is where there are terrestrial or land reservoirs. In Kansas, the primary reservoir are skunks, but then what happens is a skunk bites another animal, and then that virus spills over or infects that animal, such as a dog or a cat or a horse or a cow. Back east, it's raccoons. There's fox in Texas. And again, those are the primary species in which this virus is found, and it's maintained in this cycle. You kind of see that white strip there between raccoon and skunk over there in the Midwest part there. And that's actually a concerted effort by the United States Department of Agriculture's Wildlife Services and they actually put out oral bait to prevent the spread of raccoon rabies further west. So they actually have a plan to eliminate rabies in raccoons by, I think it was 2053. So there's actually a national plan for that. So specifically in Kansas, we take a look at all the test data for animals that are tested in Kansas. And we have decades worth of data available. And I put some links to those references and resources at the end of this presentation for you. But in 2019, there are 842 animals tested. So as of to date, normally we have around 1,000 to 1,200 depending on the year. So that was as of the beginning of November. About a third of those that were tested in total were wildlife. We had 28 positive skunks and 10 positive bats. So that's not unexpected, right? I told you that the rabies reservoir in Kansas were skunks, and we have rabies and bats in Kansas. As far as domestic animal goes, the majority of animals that are tested for rabies are domestic animals. We had a kind of a wide variety this year. And the majority, the most cases we had that were rabid were cats. We had 7. I realize that might be a little difficult to see, but there were 7 positive cats. We had a couple of cattle, and typically in the last several years, the majority of our domestic animal cases have been in cattle. We had a case of rabies in a bottle lamb, 1 horse, and 2 dogs, and one of those dogs was a rabid dog that was imported by a rescue group from Egypt, and I'll talk about that at the end of this presentation. So animal vaccination does provide a buffer between wildlife and people. That's why it remains critical that we're vaccinating our dogs and cats, even horses, against rabies. There's a licensed rabies vaccine for dogs, cats, ferrets, horses, cattle, and sheep. It must be given by a veterinarian or under direct supervision of a veterinarian, and it should be administered according to the label. And there is a great reference list for all the vaccine types and their administration routes and frequencies that can be found in the Animal Rabies Compendium. I have a link to that published at the end of the page, and that's updated every few years, but that information might be helpful to you. So there's no evidence to show that vaccinating an animal every year with a 3-year vaccine is any more beneficial than vaccinating it according to the label, boostering it every 3 years, or giving a 3-year vaccine early. There's been no evidence to show that that makes it any more efficacious than what it's licensed for. So again, using the vaccine according to the label is recommended. There is no statewide rabies vaccination law in Kansas. The vaccination laws are really handled at the municipal level, although there are 10 counties with the rabies vaccination law that extend to the people who live outside of city limits. There's about 200 out of 637 rather municipalities in Kansas that require dog vaccination, with a few less than that requiring vaccination of cats. So a lot of these, I've read through a few of these. Some of them are fairly old and have not probably been updated or reviewed anytime within the last several years. So I would encourage you, if that's something you haven't done, is to take a look at whatever city your shelter is in, to go ahead and review what the city ordinance is. Some of them are requiring annual vaccinations. I would encourage folks to change that to just a current rabies vaccination. That way people could get the 3-year vaccination if they so wanted. But that can be challenging, I know. Also, I know that there's some challenges too because of community cats and the changes that are coming around in some municipalities. And so how do you tackle that? So there's a lot to go on. Also, or a lot to consider. Also, medical exemptions. I haven't found any ordinances that have that I know of that have a medical exemption. So say you have a older dog, 10 years old, has been vaccinated against rabies routinely its whole life, but now it has an autoimmune disease, and the veterinarian doesn't feel like it should be vaccinated against rabies because it would be detrimental to the dog. Most ordinances don't have a medical exemption for that. So that person, if their dog wasn't immunized, then would technically be out of compliance with the ordinance. So that's why I would encourage you guys to review your municipal law. Rabies is reportable when it's suspected in animals or people, but we're talking about animals today, to the Kansas Department of Health and Environment. And although animal shelters are not required by law, we do ask that you report, please, to that 877 number if you do have a suspect case of rabies. The Kansas State University Rabies Lab does send all the results daily to us. So whether they're negative or positive or unsuitable, we do get reports every day, usually by 4:30 or so. But please, if you suspect a case of rabies, please give us a call. We'll connect you with the local health department. And if it turns out to be negative, that's fine. We'd rather be notified early on and not have to work, and then call off anything we needed to do upon finding a negative than not finding out about the positive until we get the test result. Local health departments and KDHE can help do rabies exposure risk assessment. So what that means is if we get a positive rabies lab result in an animal, we notify the local health department by a phone call. And then the local health departments in turn will call the submitter, which is usually the veterinarian, to find out what's going on with this animal in the situation. And then also will then ask about potential exposures, and we'll do make post-exposure prophylaxis recommendations for the people. They'll also call the owner of the animal and to find out who had been in contact with that dog or cat 10 days prior to the onset of clinical signs. The virus can be shed right before the animal becomes clinically ill. And so we do go back 10 days. And then any other animals that animal may have exposed, the local health department is also responsible for that as well. So again, as I had mentioned earlier, if you have not already reached out to your local health department, I certainly would do so sooner rather than later to discuss that. So how do we do an exposure risk assessment? Well, in the case of where we don't have the animal, so say it bit somebody and ran away, or somebody thinks they may have been exposed, we just want to know, were they actually exposed? The bites are pretty self-explanatory. The teeth break the skin, there's blood, the saliva gets into the cut, and that's pretty obvious. But most of our exposures really are non-bite exposures. So that's when the saliva gets into mucous membranes, such as the lining of the inside of your mouth, your nose, or your eyes. And the rabies virus can actually penetrate intact mucous membranes. I had told you the rabies virus wasn't that hardy, and it really does need an open wound, fresh bleeding wound to actually get in. So it cannot penetrate intact skin. It really does need a fresh cut. However, that is a little bit different with mucous membranes because the rabies virus can penetrate that. So we've had cases before where a puppy was licking kids on the inside of the mouth. That's an and the puppy ended up being, was rabid. That was an exposure to those children. So most of again, the bites are pretty self-explanatory and pretty straightforward. It's those non-bite exposures that can need a little bit of work. We talked about why the location of the exposure is important. The vaccination status of the person, because if you're pre-immunized against rabies, then you need less vaccine post-exposure wise, and we'll talk about that. If the animal's available, so say again, if this is in the instance of an animal that's bitten somebody, if the animal's available for testing, if it's a dog or cat, we can actually observe them for 10 days. We don't have to euthanize the animal. And we're going to go through some scenarios for that. Also, what kind of an animal is it? Is it wildlife versus a domestic animal? Is the animal known to this person? Was it normal behavior for this animal? It was a known aggressive dog. It's bitten several people before. This is probably normal behavior for it. Or is it a normally sweet, kind animal that out of nowhere was acting strange and bit somebody? So there's a lot of factors we take into consideration. I had mentioned to you that there were some animals that are more likely to have rabies than others, and there's a list there on the left. Again, any mammal can get rabies, but things like rabbits, chipmunks, squirrels, small rodents are less likely to be rabid, mainly because they wouldn't probably survive the initial attack by the rabid animal. And so we generally do not recommend post-exposure prophylaxis for bites from these animals unless the animal's behaving really abnormal. I think I've only recommended post-exposure prophylaxis once for a squirrel in the 11 years I've been here. And then never for mice or rats. It's not that they can't get it again. It's like they're probably not cannot be naturally infected because they would have been killed by the attack from the animal. We also generally don't recommend post-exposure prophylaxis for opossum bites. But again, every situation is different. So public health can make recommendations for post-exposure prophylaxis. Ultimately, it's up to the healthcare provider, the doctor or the mid-level provider, whoever they're seeking healthcare from, to make that final decision, because post-exposure is a treatment, not a prophylaxis. It's not just, I guess I should say, it's not just prophylaxis, it is considered treatment. Now, the situation with bats is a little bit different. I did tell you that the rabies virus prefers a fresh, open, bleeding wound. It can't penetrate intact skin, and that's correct. With bats, that's a little different. And there have been some studies that have shown that the virus can replicate in some of the deeper layers of the skin and not just the muscle. And so that coupled with the fact that the human rabies cases that we get in the United States are from bat virus, and oftentimes about half the cases or so, we never know exactly what their exposure was. It's sort of cryptic. That's why our recommendations are a little bit, we're a little bit more aggressive with our post-exposure prophylaxis recommendations with bats. So any direct contact with a bat, it flies into your hair, you're walking around outside. This actually happened to a coworker here. They were walking their dog out in the woods, a bat flew into their head and then flew away. They were recommended post-exposure prophylaxis. Again, limited visible injury. This picture over here on the right shows you that little black arrow in the picture on the top A is pointing to a little hole that's made by the tooth of a bat, a big brown bat, which is the type of bats we have here. Their teeth are pretty tiny. So if somebody is in the same room with the bat and they were sleeping and are heavy sleepers, as somebody who cannot verbally tell you what happened while the bat was in the room and the bat is not available for testing, then we would recommend post-exposure prophylaxis. And that's also why we would still recommend rabies vaccinations for cats that are solely kept indoors, even if they never go outside and are never boarded and never go anywhere. We have had several instances where people have come home and found a bat in the mouth of their cat, and that would be considered an exposure to the cat, and they would either need to be boosted or quarantined depending on their vaccination status. We're going to talk about that. So now we're going to go on to management of humans exposed to rabies. And, you know, you don't really need to know I don't want you to necessarily know all the details, because this information is what your local health departments can help you with. Also, it's out there in the guidance documents, but I really wanted to stress that people that are at high risk for exposure, so your animal control officers, your veterinary staff, your veterinary nurses, should be pre-immunized against rabies. Also, if you are doing any rabies observations, quarantine cases, you really should only have people that are pre-immunized handling these animals. It's three injections in your arm. It's kind of like a flu shot. It still is a little bit pricey. It's about $1,000 for all 3 doses. You should be getting their titers checked every 2 years because there's no booster schedule. It's just based on their titer results. And then here's a thing, though, to know that if this person is exposed, they only need 2 doses of vaccine, and that's it. They don't need the human rabies immune globulin, which is the really costly part of the treatment and potentially more painful part of the treatment. So again, if you have people like animal control officers, your veterinary staff, anybody who could be handling suspect or rabies quarantine animals, I would strongly recommend that they're pre-immunized. And that is actually a recommendation by the Advisory Committee on Immunization Practices Human Rabies Prevention document. So it's a national recommendation. If you are bitten, or you or your staff, if you're not really suspecting rabies, the first thing you should do is immediately wash with soap and water. That will help kill a lot of bacteria and viruses, just the physical action of the scrubbing with the warm soap and water. I would say any cat bite at all should be evaluated by a physician or a healthcare provider immediately, not necessarily for rabies issues, but because they're so easily infected. We also recommend a tetanus booster if you have not had one within the previous 5 years, and appropriate antibiotic therapy as deemed by your physician. For non-bite exposures, immediately flush your mucous membranes with clean water, so splashing your eyes or the inside of your mouth out with water. But any wounds that you get should be handled this way. So for post-exposure prophylaxis, if you've never been immunized against rabies, you've been exposed, say you were bitten by a feral cat, the cat tests positive for rabies, you would need human rabies immune globulin. That amount is based on body weight, and that provides immediate antibodies to help combat the virus immediately, while the vaccine then primes your own immune system then to make antibodies. So kind of think of the HRIG as a sponge, kind of helping to sop up that virus and kind of putting a Band-Aid on it while your body's making your own antibodies with the vaccine. So depending if you're healthy, it'd be 4 doses of vaccine on those days. If you're immune compromised, say you have diabetes or something, then you'd need 5 doses. The cost varies, but $20,000 to $30,000 is pretty common, it seems like. And the main bulk of that cost is due to the rabies immune globulin. We don't have any financial support for that at the state. We don't have any immune globulin here. The cost would be borne by the patient. And so it can be pretty pricey, even if you have insurance to pay whatever your deductible may be. We have had some instances where insurance companies have denied payment to people if they didn't think that that person had an exposure. I'm not clear as to who's making that determination on the insurance company's end, but we have had some people call here trying to find some help for that. There are patient assistance programs through the vaccine companies if somebody is financially, if meets financial guidelines, usually at or below poverty line. And I know there are hospitals that do have patient support programs, but again, KDHE doesn't have anything, and none of the local health departments do either. So now, management of animals causing exposure. This is where it gets a little bit confusing for folks. So you guys have probably done 10-day observations on animals, and that's when an animal exposes, a dog, cat, or ferret, usually dogs or cats, have bitten someone, and we observe them for 10 days. So you're like, well, they have their rabies vaccine, they're currently vaccinated. It's just out of an abundance of caution. There are very, very, very rare instances of where there have been rabies vaccine failures. And by rare, I think the last report I saw, it's already a decade old, and they had looked at like the vaccine failures from I think 2000 to 2008 or so, and they had 12 documented ones. So think of the hundreds of thousands of dogs and cats that are immunized against rabies, and up to like 12 failures, but still the 10-day observation period. And then non-bites are assessed on case by case. So here's the 10-day observation period. You can usually wait to administer post-exposure prophylaxis because we're going to observe the dog for signs of rabies. But be sure you don't vaccinate the animal during observation. Sometimes they can have a reaction to the vaccine that mimics the early signs of rabies, and you don't want to have that happen during your 10-day observation period. The location of where the animal is observed, because a lot of these happen at home, is really up by law up to the local health department. If during this time the animal develops signs of rabies, you euthanize and test the animal. If the animal's alive at the end of 10 days, it does not have rabies. And if it's not currently immunized, go ahead and vaccinate. So again, the 10-day observation period is if this dog has bitten somebody. So here's some scenarios. You have a 12-year-old owned dog who bites a person. It's an indoor residential dog. It's been vaccinated appropriately its whole life. It was a provoked bite. Say the grandkids came over and were yanking on the dog's ears or whatever, and it had an ear infection. Okay, and it did. I'd say that would be normal response for the dog. So we wouldn't necessarily even recommend the 10-day observation on that one because it's an owned dog. It's not a stranger's dog. Again, this varies by jurisdiction. So some of you may have more strict, more strict rules or recommendations than we do. The 5-year-old dog, so this next scenario is a 5-year-old dog that's owned, bites a person. This dog is a farm dog. It's only been vaccinated one time, like 4 years ago. The bite was random. Normally a pretty friendly dog, but it's been acting kind of strange, and it was a unprovoked bite. And this is really abnormal for this dog. We would recommend a 10-day observation on it. So a stray cat bites a person. It's a feral cat. This person's been feeding these cats. It doesn't know anything about it. They reached down to pet the cat, and it just bit them. You could call it a provoked bite or an unprovoked bite, but since it's an unowned, an unwanted cat, you could euthanize and test for rabies. Now, we have had some issues where feral cats have bit people that have fed them, and people still want the cat. They want to adopt it. So you could still do a 10-day observation on that. But again, it would be observe or euthanize and test. And then say an owned cat bites a person. It's an indoor-outdoor cat, never been vaccinated, and it was what we call provoked bite for whatever the scenario you want to, they tried to grab it up and give it a pill or something, and we would recommend a 10-day observation. The only difference is if the stray cat is unowned and unwanted, you can euthanize it. But if somebody wants to keep the animal or adopt it out, you can do the 10-day observation. So again, 10-day observations for when the animal bites somebody, a human. Now, for management of animals exposed to rabies, this is where the animal themselves have been bitten by a rabid animal. And so the location of that 4 or 6 month quarantine is determined by the local health officer. And some counties are pretty strict about this and say they have to be quarantined at a licensed facility, and they won't do a home quarantine, and some will. Again, that's really up to the local health officer. So when an animal is exposed to rabies, this again, say the dog got in a fight with a skunk, or the cat was found with the bat in its mouth and the bat tested positive. If they're currently vaccinated, you boost them with the rabies vaccine and you observe them for 45 days. If they're out of date, this changed in 2016 with the national recommendations. We do treat them as if they were current. So we'll boost and observe for 45 days, but they have to have proof that they were vaccinated. We'll talk about that. Oh, here we go. So if they don't have proof, so they picked up this animal off of Craigslist or something, and they were just verbally told it had been immunized, but they don't have proof. We can actually do work with K-State University to get this prospective serological monitoring done. So it is a way to see if the animal has a titer, but that has to be done case-by-case basis, and it has to be done at the owner's expense. And the animal will remain in quarantine until those results are done. It's only since we allowed that in 2016, I think that's only maybe happened outside of this Egypt dog situation a couple of times. So finally, if they're unvaccinated, it would be euthanize or a 4 to 6 month quarantine. And so I will say that since we've changed our regulation in 2016 to where out-of-date animals could be boosted and boosted with a rabies vaccine and observed for 45 days, it's decreased the number of animals that have been euthanized, which is good news. And none of them have broke with rabies, so also great news. So here's some scenarios. You have a 3-year-old dog in a pen with a skunk that was never tested for rabies, but we just assume the skunks have rabies, say it got in a fight. It was overdue for a vaccine, and it was vaccinated at least once, and the owners have documentation from their veterinarian of rabies certificate. So the dog was boosted with rabies vaccine within 96 hours, and you can just observe it for 45 days. Another scenario I'd already mentioned, this cat chewed on a bat that was never tested for rabies, because the owners picked it up and then threw the bat away. We would just assume the bat has rabies. They bought the cat off of Craigslist or adopted it from a friend, and the friend said, oh yeah, they had rabies certificate vaccine. I'll get you the information, and they never did. What you could then do is do the prospective serological monitoring, which again has to be approved first by KDHE and the local health department. If it's negative, so there's no evidence that the cat was previously immunized, it would be quarantined or euthanized. But if there was a positive finding, meaning that the cat was previously immunized, you could observe it for 45 days. So again, 10-day observation is when for an animal, a dog or a cat bites somebody. The 45-day observation for 6-month quarantine is for when animals are exposed to rabies. So all of that's documented in our rabies control requirements document, which I've linked to at the end of this presentation. And again, feel free to call or email us with help or ask your local health department. They're a great resource. So here's kind of what we talked about at the beginning of the hour. Again, call your local health department or call us for all suspect cases, but also with any questions. And if you have that relationship with your local health department before you need them, that's always great too. Protect yourself and your staff from potential rabies exposures, review local requirements, and develop written protocols if you don't already have them. I mean, your staff should be trained on this to know what they need to do in the event of a bite, who should be handling rabies suspect cases or quarantines, and that should all be outlined to help reduce potential exposures. So here's those resources I mentioned, and Tyler is recording this and it will be available. I could probably also have her just post the data, or these links rather, on the website, or just a link to our webpage too. So lots of good information there on surveillance data and test data. Also just some general rabies information by CDC and some others. So now in our last little bit here, I'm actually going to talk about a case of rabies we had in a dog this year. That was actually an imported case of canine rabies from Egypt. And so I'm going to jump into this now. So we got a call on a Saturday, actually. Usually it's Friday afternoon at 4 o'clock, but this was on a Saturday. One of our on-call epidemiologists took this, and it was on February 23rd. And a veterinarian called to say that he had a dog that he suspected that may be rabid. So on February 21st, the dog had been seen by Veterinary Hospital A, where it had bit a technician. It was, the person who called was from Veterinary Hospital B. And when they were talking to the veterinarian, they said, well, the dog was imported from Egypt. So that raised a lot of concern, sometime around in the end of January, so about a month prior. And so that raised quite a bit of concern right there. The animal was euthanized that same day on the 23rd and was tested and did test positive for rabies at Kansas State University on the 24th. Was sent to K-State on the 24th and tested positive on the 25th by direct fluorescent antibody. We notified CDC and folks and actually sent the specimen to Centers for Disease Control and Prevention, where they typed the virus and were able to identify that it was indeed canine or dog rabies virus variant, specifically from Egypt. So we knew there was no way that this dog picked up rabies in Kansas because the viral pattern said it came from Egypt. So what happened? So we begin our investigation. The dog became clinically ill on February 20th. It was in a foster home, and it began excessively drinking and eating and having diarrhea on the 20th. Up until the 20th, it had been pretty normal. It was just acting really, really strange. It vomited on the 21st and also ate a blanket, which is really pretty strange. So again, this dog is a normally very sweet dog and had no other health issues until this issue started on the 20th. On the 21st, it was stumbling around, was hypersalivating, was drooling, and had just really, really strange vocalizations. So the foster family packed up the dog and they took it to Veterinary Hospital A, and that's where it bit a technician. They thought it may have had an obstruction. So they transferred it to a referral hospital, Veterinary Hospital B, and they did say that it had protruding third eyelids, and they did see on ultrasound some sort of obstruction, and so decided to do surgery on it. I think it was the blanket. And so it had surgery on the 22nd, but it rapidly deteriorated on the 23rd. It was laying on its side. It wouldn't get up. But anytime somebody would come around, it would try biting them. It was doing this fly biting behavior where this dog was like randomly biting at the air. It was really bad, so they recommended euthanasia. That's when the veterinarian at Hospital B gave us a call. So then we reached out to the animal rescue group, because again, this was a foster family that was taking care of this dog, actually foster family in Missouri. And what we had found out was this dog was one of 26 dogs that had been flown from Egypt into Canada. And then they were driven across the border from Canada into Kansas on the 28th. And then they were all these dogs were fostered or adopted. There was a patron of this rescue group that had donated some money for this cause, and so that's why these dogs were brought back. And so we were trying to find, as I had previously mentioned in this presentation, we needed to go back 10 days prior to the onset of symptoms to identify all the people and animals that were potentially in contact with this dog to make prophylaxis recommendations. But we also had the job of trying to figure out where this dog had gotten infected, and then of course now we're concerned because there's 25 other dogs that may have been exposed at the same time or the same place. So we notified the Johnson County Department of Health and Environment, the Kansas Department of Agriculture, Missouri Department of Health and Human Services, the Missouri Department of Agriculture, and the Centers for Disease Control about this case, because this is a foreign animal disease incursion, essentially. Canine virus variant rabies was eliminated in the United States in 2007, although, again, dogs are getting rabies in the United States from other animals. We don't want this back in the United States. And again, this dog was part of a shipment of 26 dogs from Egypt. They're all fostered in Kansas or Missouri. All the dogs did have documentation, which they're required to have when they're being imported, a veterinary inspection, or a health certificate, a rabies vaccination. They were all vaccinated in Egypt. And then they also came with paperwork showing that they had serology or titer for rabies, which actually is not required for the United States. But the animal rescue facility wanted to kind of do everything they could to make sure these dogs were healthy and had that serology done. USDA Animal Plant Health Inspection Service, Animal Care Division, a few years ago started requiring that any dogs that are imported into the United States that are going to be resold, which either means being resold for profit or even adopted out, also have to have this permit that's free. That this rescue organization did not have that permit. But the dogs did meet the requirements for the permit, being greater than 6 months of age, having a rabies vaccination certificate, and a health certificate. So we did the risk exposure assessment. The veterinary hospital staff at Veterinary Hospital B, their corporate headquarters had actually informed all their staff to seek post-exposure prophylaxis prior to us getting a hold of them to do an exposure risk assessment. So there were 39 people that received post-exposure prophylaxis. And so nobody at Hospital B had been bitten. And so we're really unsure how many people were truly exposed. The rescue staff and family, there were 5 people that were recommended and received post-exposure prophylaxis. And the foster family, humans and animals, there were 2 people who were recommended and received post-exposure prophylaxis. And this foster family had quite a few animals in their home. They had 12 dogs. 2 of those, unfortunately, were unvaccinated and were required a 6-month quarantine. The other 10 dogs were just a 45-day observation. They were all currently immunized. So what did we do with the remaining Egypt dogs? There was some concern by the foster and adoptive families that they would be euthanized. Because we have the prospective serological monitoring as an option, we could do that, but we did require all those dogs to be quarantined. And the quarantine length depended on whether or not they were previously immunized. Now, remember, I had mentioned to you that they all came with a certificate that included information on the vaccine, the lot number, and the date, and that all checked out. However, the dog that broke with rabies was supposedly vaccinated, and I just told you how rare rabies in vaccinated animals were, so we were concerned that maybe these animals had not been immunized, or there was a vaccine failure. So we did require them all to be returned to the the animal rescue group. We worked with the Tyler's group, and it was Jeff Jones at the time, but we worked with the animal facility inspection program. They went to this facility to inspect them to make sure that they could handle quarantine of all of these dogs, because in our regulation it does state that that it is the responsibility of the owner of the animal to pay for quarantine. So we're enabling them to quarantine at that facility helped to save them quite a bit of money, and allowed these dogs to be quarantined there. So we went ahead and did the prospective serological monitoring on these dogs. And again, I was telling you about this. What you do is you pull a blood sample, you vaccinate the dog against rabies or booster them, and then 5 to 7 days later, you pull a second blood specimen, and then you ship it to K-State, and they analyze the blood. So if there's a significant rise in titer between those two specimens that you pulled, and it meets certain criteria, then you can say that that animal was previously immunized. That's sort of the short answer to that. Well, only 7 of those dogs, those 26 dogs, had evidence that they were previously immunized. We went ahead and quarantined them for 4 months, though, because to be on the safe side, again, canine variant virus, just really concerned about that. But 18, the most of these dogs didn't have any evidence of previous immunization. They were quarantined for 6 months, and they actually received 2 vaccines while they were in quarantine. They all survived, which is great news. And they, to my knowledge, I think they've all been adopted or fostered out. So great news, nobody else broke with rabies. So again, part of our investigation was trying to figure out, well, were these animals vaccinated? Was there a failure in the vaccine? What happened? All we found out was that, based on the paperwork, that they were immunized either on November 1st or December 1st. There were 3 different rabies vaccine manufacturers and 5 lot numbers, and we contacted all 3 vaccine manufacturers, and all the lot numbers were verified as being true numbers. The serology that I had told you that they had done while they were in Egypt, we tried to contact the lab, and we were never able to get a hold of anybody. Dr. Susan Moore at the Kansas State University Rabies Lab has told us that there is issues with falsification of rabies serology results. They actually have it happen to K-State quite frequently, and they've developed a method, a verification method for people to actually be able to come online to see if the test results they have from K-State are actually true. And there's some pretty good forgeries out there. Unfortunately, this is not the first time this has happened, and that's one of the reasons why we are so keyed in on this. In fact, there have been 2 other rescue groups who have imported dogs from Egypt in 2 other states that have developed rabies. And in one of those cases, in Virginia, they were able to confirm that the rabies vaccination certificates were falsified. And so, that does happen. What I found really interesting is there's a Federal Register report that was published a couple of years ago that talked about just the sheer number of animals that are of dogs specifically that are imported into the United States. And I'll tell you, I had no idea that there were a million dogs imported into the U.S. each year, and about 100,000 of those are from countries considered high risk for canine rabies virus variant. That's what CRVV stands for. Those dogs all do have rabies certificates and health certificates, like these dogs did, but that is concerning. But so this is the 3rd time this has happened, and because of that, CDC, the CDC's Division of Global Migration and Quarantine, is actually the agency responsible for the dogs being imported into the United States. as far as the requirements go for rabies. And they went ahead and placed a temporary ban on importing dogs from Egypt. That happened on May 10th. And they're trying to figure out what exactly they're going to do as far as requirements for the future for this ban. And so because this was the third dog in 4 years that was from Egypt that was supposedly vaccinated but broke with rabies. And so I'm not sure what they're going to decide. It's probably going to take a little bit longer. So we'll just have to keep an eye on that and see what happens. So there are a lot of people who helped on this investigation, many more than are on this slide, but I just thought I would highlight the people who put quite a bit of time into this. It is definitely one health effort and many people, many hours on this. So World Rabies Day is September 28th. There is a global plan with the World Health Organization, and the World Animal Health Organization, the Global Alliance for Rabies Control, to end human deaths by canine rabies by the year 2030. And so I think that's pretty exciting that we could see that in my public health career, not just in my lifetime. So with that, it looks like we have just a few minutes for questions, but again, I can hang out here till after 4, and you can always email me, and you can either pop on audio or you can have questions in the chat box. So with that, do we have any questions? Okay, it looks like. Okay, what is the oh, here we go. I had to read through all my messages. Here's a question. What is the exposure risk due to simple scratches? That one is, it depends on the animal that gave the scratch. The reason scratches are mentioned, as far as I can find, were some documentation back in the 50s of some rabid wolves that attacked villagers in Russia, and supposedly people got rabies just from scratches. Again, the rabies virus has to be, needs to be in a fresh opened wound or intact mucous membrane. So theoretically, if the animal licked had sopping wet paws and then scratched you, that could potentially be an exposure. If it was a scratch by a skunk or some wildlife, a coyote, I would be more inclined to say that was an exposure versus just being scratched by a dog with no salivary exposure. So if it's scratched by a dog or a cat with no salivary exposure, I would say that there's virtually no risk. So again, in those cases, I think those case-by-case basis, you may want to consult with public health or your health care provider. And that's the thing. A lot of the times, it seems very black and white, but we get all the calls about the cases in the gray. Here's another question. How long could the rabies virus survive in a water bowl after being used by an infected animal? Is transmission likely or possible? I would say that's pretty low. It's definitely not zero. So, it really does need a living host. I mean, I'm not exactly sure how long it could live just in plain water. But I would say that the risk would be fairly low for transmission. So likely, I mean, I guess you have procedures, and I would assume that you have procedures in place to be cleaning and sanitizing water bowls and water dishes on a daily basis in your facility. So I think just doing even soap and water would be enough to kill it, or throwing it in the dishwasher. I'm not sure what your procedures are. And that's why if you have a positive animal, then I think working with your local health department to kind of make some of those determinations is helpful. But I would say it's probably on the low side of risk. All right, well, we're right at 4 o'clock. So seeing as there's no other burning questions, I appreciate your time. I know you guys are very busy and have a lot of other things to do, and I hope you found it useful. And again, if you did or not, please let Tyler know. And then, and if enough people say they found it useful, we can make this a regularly scheduled program in some other time next year. We're here to answer questions. There's no silly questions or stupid questions. There's a lot of information regarding rabies. So please do call your local health departments or make an appointment just to chat with them. And then give us a call. That 877 number is good anytime, day or night. During business hours, after business hours. That'll make sure that you talk to somebody who's on call. I'm only here 2 days a week, so you'll have to leave a message if it's not urgent. But if you need an answer right away or sooner rather than later, please do call the 877 number so we can help you. So thank you again, everybody, and I hope to meet you in person or talk to you soon. Take care.
Thank you, Ingrid. We appreciate it.
Thanks, Tyler.